Hi, I am Michael Chevy Castronova. I'm the business editor here at the Gazette and editor of Iowa Ideas Magazine. Thanks for joining us today for our live panel discussion. This is part of our in-depth week series. We're focusing on workforce issues here in Iowa. And of course, this is all ahead of our big annual Iowa Ideas Conference that this year is going to be October 14 and 15. Our topic today will be on coping, if that's the right word, with COVID-19 and how that's affecting the workforce. This is, as you know, upended much of our already existing challenges for hiring and retention here in Iowa. But first off, and we do have a panel here today, so let's welcome our panel members. I'm going to ask each of them in turn, as they appear here on my screen, to tell us your name, where you work, and just a little bit about what you do there. Dr. Peter Orzeman, would you go first, please?
I'm Peter Rozum. I've been a professor of economics at Iowa State University since 1982. My area of expertise is in labor economics. And so among the things that I research are the Iowa economy.
Thank you. Jason.
Hi, I'm Jason Glass. I spent about 20 years in human resources roles for several local companies and now teach at the University of Iowa Tippie College of Business, where I'm a lecturer in human resources and leadership management and entrepreneurship topics. I'm a past chapter president of SHRM, which is the Society for Human Resources Management, and now on the state council for that. And I do some consulting. So I do have my own consulting business called Glass People Solutions, where I work with companies on some HR topics and executive coaching.
And in your spare time. Yes. Jasmine.
Hi, good afternoon. I'm Jasmine Elmwyatt. I am the new Vice President of Training and Education Services at Kirkwood Community College. So I oversee the departments that provide the non-degree or non-degree programs that would pertain to certificates, adult education, workforce skills. We do have a couple of degree programs within our occupational health area, but primarily anything that an adult might sign up for in order to try to make themselves more employable. Prior to rejoining Kirkwood, I should say, in July, I did work here for a period of time from 2008 until 13. I was in charge of economic development for the city of Cedar Rapids for about 8 years. So in total, 13 years of experience dealing with education, economic development and workforce for this region that we're in.
Thanks. And Jasmine, part of your job and part of the department you see is you work with and communicate with businesses for what they believe they might need in terms of skill sets, right?
That is correct. Yes. So we have kind of two sort of main ways that we determine our programming. So one is just kind of looking at trends and what's out there for open enrollment offerings. And then the secondary piece, a lot of what we do is very heavily influenced by what the local business community is needing. So whether that is just in terms of the certificates that we're offering, and the college truly is actually moving in the direction of what many in academia are doing as far as guided pathways programs. So we're really trying to correct what probably should have been the case all along, which is if you start in a education program of any sort, that hopefully that would be a starting place for you and that you could move seamlessly into credit programming in sort of a family of different degree areas. So there's also a portion of the division that focuses on customized training programs. So where it gets even more specific to working with companies on competency-based education programs, where we would actually take a program and really tweak it and make sure that the specifics of what that program is offering fit what that particular company needs.
Okay, thanks for that.
Mm-hmm.
And Ryan.
Michael, hello everybody. My name is Ryan West. I'm the Deputy Director with Iowa Workforce Development, and we do a lot of things and all things workforce.
Yes. Yes.
Too many to count, but happy to be here and excited to talk about some of the things we're doing to help connect workers with employers.
Okay, thank you. And for those of you watching, remember, you can submit questions in the chat box down there at the bottom of your screen, down there. And those will go to our room host, who will take a look and then pass them on to me. And share with the panel. So let's get started, shall we? This is for everyone. This is for all four of you to contemplate. We are more than 18 months into the pandemic, and now we have the Delta variant, because we needed more issues. Iowa has positive cases akin to what it saw in November. We have a vaccine available, yet if I've got this right, just more than 50% of Iowans are now fully vaccinated. So again, this question is for each of you. What do you see as if you were to pick one big challenge, what's the biggest challenge caused by the pandemic to Iowa's economy, to its workforce? And is that temporary, or is that a permanent challenge? Or what would be the one biggest hurdle we've got? Peter, you want to go first?
Sure. I think the biggest hurdle is in the hospitality, entertainment, and restaurant sectors. That was the sector that was hit most heavily by the pandemic, with massive reductions in employment. And we thought that was going to be coming back great guns. If you look at employment in leisure and hospitality in Iowa, we're about 7 percentage points below the national average in terms of the recovery of jobs in that sector. And I think that is related not as much to the employees as, but I know that there's a reluctance for people to enter those markets. But I think the customer base is also a little bit leery about going and entering those sectors relative to before. And so I think that is a reflection of the overall unease in the population about the possible spread of the disease.
I had to stay at a hotel. I had to go check on my father, who lives in Ohio, and I stayed in a hotel just outside of Pennsylvania. This would have been maybe 6 months ago or so. I might have been the only guest in that hotel.
Yeah, and I think I'll add to just a more general thing, which is uncertainty. I think is the biggest challenge. Is that I think there was a sense a few months ago that we were seeing this kind of downward trend, and that there'd be this recovery, and then the Delta variant hit, and so I think not only that sent shockwaves through, well, we can't fully open, or a lot of people in the workforce aren't coming back, for some of those reasons as well. So it's only adding to a labor shortage that we had long before all this happened. So that's just exacerbated things. But then I think it's really been a shock to our system collectively to say, well, now we thought we had this big peak, and then we had this bell curve and we're coming off of it. Now we see the next blip, and so that's shown that we can have more blips. And so we don't know if that means that what happens when the Echo variant or the Foxtrot variant or whatever the next one is comes. And so planning for a business, or trying to project what you're doing, or planning as an individual about when and how and what kind of job I want to go into is so difficult right now. And so I think we're just seeing a lot of hesitancy on choices, and that's I think rippling through a lot of these things.
Choices on the part of whom, Jason?
What's that?
You say we're seeing lots of choices.
Well, or holding off on choices, whether that's in hiring or whether that's in whether I go, if I'm somebody that is wants to go back to work or change jobs, or or start a business. I mean, we're now at the point where 18 months in, where there's a lot of entrepreneurial activity that has they've been all but frozen, which is where a lot of new jobs come from, because it's very difficult to think about starting a business, particularly in some of the industries that Peter mentioned, in this environment. That's where a lot of our kind of entry-level jobs come from.
So I would say that I, agree with the comments that have been made already, but I would like to look a little bit about from the angle, I think, of where the colleges are standing, and certainly I think those who work with the labor market. And I believe that while it's a challenge, I think we do actually have a really great opportunity on our hands as well. I think that we have, any of us who have worked in the workforce space in this, in the Iowa market, probably across the Midwest, have all sort of been hearing about this cliff for a very long time, with retirements and, that there's skills mismatches, and it's not new. This information is certainly not new, but I think that the pandemic at least anecdotally, and certainly there's many studies I think that are looking into this more, did cause a number of people to make decisions about retirement that maybe they were kind of holding off for a longer period of time. So we did face this kind of finally face this labor scare that we were hearing about for many years. And so I think the opportunity there for us is that a couple of different initiatives that are underway will hopefully mean that we're also speeding up the solutions piece to that have also sort of been treading water for a very long time. So there's a large initiative across the state of Iowa, the Industry 4.0 initiative, that's really looking at automation and how do we work smarter as companies, and how will the Internet of Things impact the way that businesses are run across the state of Iowa. And so there's been a lot of effort and a lot of partnership across disciplinary institutions on how do we actually implement this for the businesses. And we also are seeing, I think, probably more serious employer participation than maybe what had been there in the past. So I think for those, again, who work sort of in the education space or who work in workforce development, employers have always been interested in seeing more labor come their way. But I think there was always this hope that people would come sort of prepackaged with all the skills and education and training, and that they would be able to make decisions based off of that. And that's just not been the reality for them. So even if they are receiving an abundance of applications, there's any number of reasons why these applicants aren't meeting their needs. And so the conversations, at least that I've been having since stepping into this role, and certainly before that, is that employers are actually more invested in taking opportunity to help individuals kind of improve their circumstances. So if you are paying above a living wage in the state of Iowa, somebody who maybe didn't have the skills to apply for one of your positions and thus would have been forced to figure out a way to become equipped with those skills in the past of their own volition. Now, I think that there is more interest in providing supports that will allow individuals to actually skill up into these roles without meaning, hey, I have to quit my job and now I can't pay my mortgage, or I'm going to be forced to work a full-time job and then attend a number of classes in the evening, which creates additional challenges with childcare and everything else. So I do think that there is some serious opportunities and good conversations happening about how do we solve this. And there seems to finally kind of be that buy-in across private sector, public sector, education. It's all sort of starting to coalesce, I believe.
That's optimistic, right? So Ryan, yes, Ryan, what are you seeing from the state level?
Yeah, I agree with everybody saying. Dang baby boomers, they retired during the pandemic. It's a little bit of all of that. I think the biggest challenge, obviously, is connecting job seekers with employers. But as Jasmine said, I think employers are looking at different opportunities now that they wouldn't have just 2 or 3 years ago. For us, one of the biggest challenges, a good challenge, is getting underserved populations the opportunity with employers. In times like this, there's these huge pockets of folks in the state of Iowa with disabilities. We have almost 6,500 folks coming out of incarceration every year, obviously a large refugee population. And, we have a large group of individuals who don't have any education past high school. And so figuring out ways to get them ingrained, not that employers aren't trying to do that, but we're really trying to push that at a higher clip as well. There's a lot of talent in those pockets, and unfortunately they don't get opportunities unless you go through something like this. And so, it's not a perfect fit for everyone, but we do think there's opportunities in there to fill some of those positions. All of this stuff is challenging. I agree with what everybody said. But on the other side of it, it's fun to try to find the solutions and work towards, helping the economy in Iowa.
You mentioned looking more deeply at hiring ex-offenders and other parts of the population. We do have a panel on that actually later on this week, I think on Wednesday, to talk more about that. And again, to those of you watching, please don't wait until the last 5 minutes of the program to submit your questions. I know you will, and I know you can't help it, but if you want to submit them now, we can start looking at those now. So, Jasmine, last year's Condition of Education report showed the number of students taking credit and non-credit courses. And we're looking at the 2019-2020 year. That dropped 1.3% and 23.2%. I'm sure you're aware of these numbers. And some of that's COVID related. But what are you seeing? What are people, people who come back to skill development programs? How long is it being projected before we're going to have these people back to that skill development? And I know you were talking a little bit about that, about business becoming more serious, that not everybody's going to come with knowing how to do welding and speak German and have 2 degrees in biology.
Yeah. So, it obviously last year, looking at numbers, it is going to be kind of the outlier year. That said, we are still down in enrollments. So, and that is the case across the country. That's the case, I think, in almost universally across the colleges that you speak to. I've heard from, there's a couple even in our own backyard that actually are doing better. And that may just be because of innovative things that they've done. And it's just been private colleges that I've heard that from. But on the credit side for enrollment, we are doing better. So we were at this point last year down 30%. We're still down, but we're down 15% from where we were in 2019. To your point, some of that certainly is COVID related. I think some of that is that we're better positioned maybe to deal with some of that. We're not scrambling as much about how do you have virtual options? How do you kind of compete in a market where, at least for us, certainly we did have some online platforms, but I think that a lot of what we've provided, we have as an institution, maybe also historically really put a lot of importance on that face-to-face interaction and time in the classroom. We tend to see that students are better served that way, generally speaking. That being said, I think that what we're also seeing is that because of this abundance of online education that's now readily available out there, and also, when you're talking about institutions of higher education, we maybe have some different barriers that some of the private companies who can offer these types of things don't necessarily have. So they can pivot quicker, they can change curriculum faster, that sort of thing. So we have huge I think obstacles that we'll have to overcome, but it is also forcing us to look at the models in which we're delivering, the formats that we're delivering courses, both on the credit and not credit side. And I think that we are going to have kind of, a tough road in front of us. And that's just that's just being honest. So I think some of this also has to do with the value of education. I think that we've all kind of seen how, at least what's been sort of portrayed in the media and the conversations that have happened, are people not necessarily valuing education to the extent that they were. So they're, we're kind of coming up against maybe more, what I would say is a harder consumer. People want to understand the value of what they're getting and how that translates into employment opportunities and what that means as far as wages. So there's just, there would have probably been a lot of these conversations irrespective of the pandemic, but certainly the pandemic and the way that traditional education courses are offered, it really did kind of, I think, leave a lot of us in a lurch. And so trying to figure out how we best position ourselves using some of the lessons learned and not knowing, what's going to happen in 3 months when regular flu season starts and if whether or not that will be impacting how we're offering them this year. So slightly better off, but not certainly not to where we were even in 2019. And that was, after some years of declining enrollments as well.
So we're starting to see a lot of major manufacturing employers advertise for jobs in ways that they hadn't before. ADM and Whirlpool have billboards. Trevero's running radio ads for jobs at its new warehousing facility. These jobs are all more than $18 an hour, I believe. Those soon will be released from parole and probation, have been told they could have tuition covered for Kirkwood's warehouse certificate program, if that's correct. Mm-hmm. Are you seeing enrollment in some of these job skill training programs that will ease some of these challenges? And I guess this is for everyone. I know you've been talking to this a bit, Jasmine, but is raising more money and advertising on billboards, is that going to help? And that sounds like a trick question and I don't mean it to be. I don't know the answer. Jason, do you think that's going to help?
Well, I don't know. And I'm not sure the companies that are doing it know. I think what we we kind of mentioned this last one, is that necessity is the mother of invention, right? Is that what's been happening isn't working, and so we're seeing employers trying more and more things. I mean, there's obviously no secret to anybody that there's a real shortage of people to take some positions. You can drive anywhere in any town, and you see plenty of help wanted signs, and it's not just from the lowest paid positions. As you mentioned, some of these are very much higher on the wage scale than entry level. So we're seeing a lot of that stuff, and so it's going to be interesting. I think that not to steal Peter's thunder on the economic side, but it's very this kind of supply and demand thing is that as we're seeing the shortage of supply of people that have the skills or the desire to want to go into some of these positions like manufacturing or the trades. I think truck drivers is a good example of that, and that goes to the education piece because you can't learn how to drive a truck over Zoom, right? And so that has to be a hands-on kind of thing. And we were already seeing pre-pandemic a fewer and fewer people that had the desire or the interest in going into that profession. And as a result, we're seeing, pay, escalating very quickly for those positions. You can make six-figure income as an over-the-road truck driver, if you're willing to dedicate a considerable amount of time to it. So I think a lot of these employers are really struggling with, what the answer is. So we've seen some pay rates go up, is that, so if that's the supply-demand equilibrium that's going up, but I think there's some hesitance like, well, I could keep raising rates, but if there is just people to take them, is that even going to answer the thing? And so I don't want to raise my rates unnecessarily, because if that's not going to answer the problem or solve the problem that I have. And so they're searching out in ways and advertising in ways that we haven't seen before, because they really are just trying to find what the right solution is.
Peter, what do you think?
Well,
you're the economist. What do you think?
There's several issues. Going back to something that Jasmine had said, how much of the reduction in the labor force is people who retired? And the Federal Reserve Bank of Dallas did a study that showed that about a third of the decline in labor force participation in the US is related to a surge in retirements. And so there had been deferred retirements in the 2 or 3 years leading up to the pandemic because the economy was so hot. And so people just delayed retiring. And under the pandemic, they didn't have any reason not to retire, right? The federal transfer payments became much more generous, and you could wait out until you'd hit either 62 or 65 or whatever your target age was. On the sidelines. And so at least a third of that decline in labor force participation is not coming back. What's surprising is in a normal recovery, when you get such a surge in employment demand, I mean, we had 10.9 million vacancies announced in July, and we filled all but 4 million of them. Now, just to put that in perspective, a normal month of vacancies is in the range of 3 to 4 million. And so it's not an inadequate demand. I mean, this is all supply, and there's upward pressure on wages to respond to that. But I think the real puzzle is why we haven't had a normal recovery of the labor market compared to the past. And it could be that people are that afraid of the pandemic, but then why aren't they getting vaccinated, right? So there's a lot of real head scratchers in terms of the really weak labor force response to this rising demand, and I think that there's several explanations, but I do think that per capita personal incomes rose in the first quarter nationally at 59.7% annual rate. Okay, that's not sustainable, right? We don't get a 59.7% increase in personal income. How much of that is due to the economy and how much of that is due to federal programs? The answer is 92.6% of the increase was due to transfer payments. And you say, well, that's got to have some effect on your incentives to be in the labor market. So
federal transfer payments, by which you mean?
Well, unemployment insurance is actually a
Unemployment
small share
insurance,
of
okay.
that. We
Yeah,
got
okay.
$600 from something related to per capita, I think, per person, if you qualified for the pandemic relief. And then there was another $1,400 per person on the the American. I can't remember what it was.
But you're talking about, yeah, I'm sorry, I didn't mean to derail you, but by that you mean the federal aid that's been coming through and state aid. Sure.
I think that the big source of personal income, I mean, personal incomes rose 9% in Iowa in 2020 on average, right? And that's the biggest increase in many, many years, but it's not related to economic activity necessarily.
Right.
And so I do think that we're really in uncharted territory.
So getting back to the part of the question related to funding that's available for individuals, there is, yeah. So there's a lot of money, right? There's a lot of money, I think, between the CARES Act funding, ARPA funding for local communities. You know, everyone's kind of looking at how do we use dollars to solve these problems. And so on the one hand, you would think, wow, we have people who are unemployed, and then we have this money, we have employers who need jobs. It seems like it should be like a really easy solution, a really easy problem to fix. I think a few different things are at play that have made it more challenging. I think number one is that we're now talking about populations of people, some with barriers, but certainly some without all of these, you know, additional barriers that we would have to overcome that we just haven't really marketed to for a very long time. So we have residents in every single community in the state of Iowa who, you know, are underskilled or underemployed. But, you know, how do you get to that particular group of people to let them know about positions that maybe they didn't think they were eligible to hold before? I think that part of it is this concept of being part of the working poor. So if a job that pays $17 or $18 an hour is something that is attractive to a person, again, the likelihood of that person being able to, you know, even if the tuition is covered, there's still, you know, a time commitment that's there, and there's an opportunity cost for every moment that you're sitting in a classroom. You know, what else could you be doing with that time, and what is it costing you as far as, you know, gas or to get to a place or to have someone watch your children while you're attending courses? I think that has been some of the feedback as well. These people need to still collect a paycheck, and quitting a job isn't necessarily an option. Some of the things that I think also have had an impact, and maybe, you know, I'm guessing all kinds of work being done. I think we'll probably study this to some extent out of my division, but yes, the cost of wages, or the wages being driven up. You know, you can get a job at a gas station in you know, Lynn County, at least, for $15 an hour now. So it's this concept of, why am I going to go work in a different environment that might be harder if there's no shortages of positions where, you know, I can get $15 an hour. And if I don't feel like going into this job today, I can go right over down the street to, you know, a fast food restaurant and get $13 or $14 an hour. So that's kind of created a phenomena that we've never really dealt with. And then lastly, I think a lot of people used to see remote work as this option that would potentially help Iowa, right? So we have this ability for people to take jobs wherever, and they'll choose to live here. But I think a lot of people have also taken positions with other companies, and that has had, again, a net negative effect on maybe employers who don't have the ability to offer remote jobs. So if we have Iowans who are living here, and they're, you know, they're counted in our overall stats, but they're not necessarily working for Iowa-based companies, I think that there is just a whole host of things around remote work that we still don't necessarily understand, and what the true impacts of that are going to look like. So I think that just like the pandemic, I feel like we're learning every single day. I feel like every prediction we make comes back kind of partially right and partially wrong. So it's just it's certainly just a time of learning, I think, for all of us. And you're seeing the response to that being and sometimes scattershot approaches. You know, it's a throw things at the wall, and whatever sticks you move forward with. So I think there's a lot of different things there, but there's a tremendous amount of support for individuals who are looking to get skills. And I'm sure Ryan probably could speak to a lot of the things that workforce development's doing that's also been pretty innovative.
Well,
Yeah,
yes, and you bring, wait, so, well, Ryan, no, I have a question before that question, but that's a good one. Thank you, Jasmine. I also wanted to ask you, Ryan, so Jasmine mentioned this notion of people living in Iowa and working for other companies. And I assume you don't mean like ADM, which is down the street here, but is headquartered somewhere else. Do we know that that's happening? Are there people in Iowa?
I defer to the economist there, yeah, on that, but I don't think we know as of yet. I think it's too soon. But I think it's going both ways. It's certainly part of the future, as Jasmine said, with more remote jobs becoming a bigger thing, and more people wanting remote jobs or being able to work from a telework standpoint. That's really seems to be rearing its head a lot. I want to go back real quick to the point you originally brought up with manufacturing. We actually, a quick plug for the Mission Employable podcast, just saying, if you're not checking that out, you should. We just interviewed somebody on Friday and they were talking about the manufacturing plants down in the southeast corridor of Iowa are now part-time workers as well. And I don't think that's been a thing in the past. So there's a lot of different things from an Iowa workforce standpoint. I cannot harp enough. It is a job seeker's world right now. And so you can jump job to job. We're seeing that in wage data records. You can, if you're able to market and sell yourself, the opportunities are open like they may never be again. So it's really a unique set of time for everybody. As far as in the Iowa Works offices, everything from resume to mock interviews to getting people linked up with employers. We've done virtual job fairs. We've done drive-through job fairs, believe it or not. We have a virtual job club. Essentially, we had a helicopter at one of that. We've tried everything to get people engaged with opportunities. And it's, I don't know, sometimes it feels like job seekers have so much opportunity that sometimes it's analysis paralysis or whatever the term is. And they don't know where to go, or they're sitting back and even waiting for the next great thing. But certainly the Iowa Works offices are doing everything they can to help connect both parties.
Analysis for paralysis, I think, is in economics.
Yeah, there you go. Yeah, sorry.
Yeah. Get Peter.
It's outside of Des Moines, right here.
We'll get Peter to explain it later. So.
Well, I don't know if I want to analyze that, but if you're looking at remote work, obviously that's primarily for the upper tail of the education distribution, and it's not for people with high school degrees. So I think you're talking about two different markets.
Yeah.
And I don't think you see a whole lot of people moving to Iowa in order to telecommute into New York City. They move to Florida. And so I don't think longer term that you're going to see a huge implication of that for Iowa, unless it's going to be the rural to urban telecommuting opportunity, which I think is slowly working, but you still have to have firms that are comfortable with people who are working remotely. And most firms want someone to show up at the office periodically. And so I don't think you're going to have a 100% remote option unless you're working for yourself, right? Unless you're in professional services and you can work from anywhere.
So again, I want to remind those watching, because we've got about 20 minutes left. If you have questions, please type them into the chat box at the bottom of your Zoom screen so that we can get them to the panelists. So please remember to do that. Okay, so here's a loaded question. I admit it. Earlier this month, as you know, President Biden said businesses with more than 100 employees must ensure their employers are vaccinated against coronavirus or be tested for the disease every week. The state projects it has nearly 2,250 businesses with more than 100 employees. That's a lot of people. That's 923,000 workers, I'm told. What pressures do you see this putting on Iowa companies to comply? And how much pressure would be caused if people still choose not to get vaccinated? So in other words, Iowa only has 3-point-something million people to begin with. We've had a worker shortage. I've been here 10 years. We've been talking about this. Jason, Ryan, Jasmine, we've been on panels. We've been talking about this. There aren't enough people to begin with. And now we've got this. And So then there's the federal government saying you have to tell them they have to get vaccinated. What do companies do, and how do they? I'm not saying do you think they should get people vaccinated or not, but I mean, how was that going to? If you have any guesses, look at your crystal balls, and what do you think?
Well, we're already seeing some challenges with just. I mean, I think that was a surprise to a lot of employers, and so there's a scramble now to figure out how to comply. So, and of course, you mentioned there's like 2,000 and some companies in Iowa alone that would fall under that. So I think there's a myriad of issues with how do we comply? I mean, you're talking about many employers that have not required. I mean, healthcare facilities, there's other businesses that have required things like this in the past. There's many employers that haven't. So trying to figure out how do we do that in a way that, we can do this, we can comply and be accurate and thinking through the logistics of that with both holistically for their company as well as with individual employees. And what do we do, when people refuse or opt out? And so what does that mean for our business when we have a worker shortage anyway, and I have some percentage of my employees that will resign or will still refuse to get the vaccine, regardless of my requirement, to do so. So there's a lot, that's adding in a lot of variables to operating a business that they hadn't planned on before. So, and we can argue whether that's all worth it because of getting the vaccines, and I get that too. But just purely from an employer standpoint, that's what they're dealing with too. And that was, in some ways, it helps, give them some cover, because I think there was probably a lot of companies that were considering requiring this before, but now they can say, well, hey, I'm required to do this now. It wasn't necessarily my choice, as an employer. So don't blame me. It's really the federal government that's putting this mandate on us, and so we have to do it. So we saw that a lot locally with mask mandates and things like that when cities were trying to do that. And so I heard from some business owners that said, well, it's nice because I don't have to be the bad guy, and requiring these things, right? So in that way, it might provide some cover, but dealing with that, and then from an employer standpoint, we will certainly have employers that will refuse to comply with that order. I mean, there's just too many of them, and there's too much, politics around that not to see that. And so how that plays out with what that means for that employer, how it's actually going to be enforced, is also going to be an open question that we're going to see. That I think I'm really curious to see how that works out.
If I could, I think enforcement is going to be a real issue. I mean, the Occupational Safety and Health Administration, this comes sort of under their auspices, is primarily related to enforcing worker safety in manufacturing and construction, places like that. They're not oriented toward enforcing office work, because that has never had a high incidence of injury or death, right? So you have a relatively limited capacity to enforce because there's only so many OSHA enforcers, and it could take many years for OSHA to inspect each firm that's under their guidelines once. And so suddenly you have a whole new area of enforcement, which is not OSHA's expertise. They're not in the business of checking, biological records. And so I think this is going to be a real issue in terms of enforcement. But let's suppose that that all the firms are going to comply. Are they going to be obligated to fire people if they don't want to get the vaccine? Well, then they're going to be tested. But testing isn't costless, and there's delays, and I think you have a real. I mean, it's easy to make a pronouncement. It's really hard to think about how this thing is actually going to get implemented. But there's, I think, one last issue, and that is that workers may quit. I mean, this was a story in the Wall Street Journal about a hospital that mandated vaccines and had to close down the ICU because they didn't have enough nurses left after turnover. And so I think that this thing could backfire. I think there's a high probability that it backfires.
I taught high school for a while, and one of the things I learned early on is if you issue an ultimatum, you are going to have to deliver on it. Somewhere down the line, that's going to happen. And you're right. Thanks for bringing up OSHA. We did have someone who asked the question, have there been any OSHA guidance on this, on these mandates? Okay.
Yeah, very little. I mean, employers are really kind of scrambling now to try to figure out, because I think there's a lot of employers that genuinely want to do this, right? Or may have already started to require or thinking about it, and this just gives them some, some further boost to do so. But I think just in my network with some companies in the SHRM network, there's a lot of uncertainty about how to do that, and in good faith, people that relate that may even that whether you agree or disagree with the mandate, that these are people that agree and want to comply, and they're still really struggling with how.
Yeah, one of the follow-up questions is, what are the consequences if an employer were to terminate? If you fire a worker who doesn't comply, well, can you do that? What happens next? And I think you're saying the answer is we don't know. Is that right?
Well, we probably know a few things, but I mean, things like, unemployment insurance, for instance. I mean, you would assume that if given this mandate, that if somebody resigns as opposed, or is terminated, for not complying with that would not be a reason to that you would not be unemployment eligible normally, because if you disobey a company rule, that's usually disqualifies you from unemployment benefits. Is that true in this case? I'm not sure we know the answer to that question, right? And so and then you have people that are opting out of the workforce and then don't have benefits, and then all the things we talked about earlier become further exasperated.
It really is a strange thing, and Jason would know more about this than I do, but as a condition of employment, if you're obligated to meet certain requirements and you refuse, then you're terminated because you haven't met the condition of employment. But if you're already employed and you have a retroactive assignment of a condition of employment, you have to get a vaccine, and that wasn't an assignment at the time that you were hired, I think it's a much grayer area in terms of what the rights are for the worker and what the rights are for the firm, and how the government would adjudicate something like that.
Right. Typically, if you required something as a continued condition of employment, you can do that. You can say this because it's employment at will. So you can say from this point forward, you'd have to have that vaccine. Well, I think actually the mandate from OSHA complicates it, because it's not necessarily an employment, or an employer mandate. It's from OSHA. So what happens if somebody, because this is for sure going to be tied up in a lot of legal challenges, both from the employer standpoint and the employee standpoint, with all those different myriads of benefits and what you're eligible for and what you're not as a result of those choices.
So there's something to look forward to. So Ryan, there was a question early on. Is there a toolkit? And I would that's why I'm going to Iowa Workforce Development. Is there a toolkit for employers on how to go from remote to on-site? Is there something like step-by-step what you can do?
Yeah, I don't think we have a toolkit per se on that. That's a good question. The guidance we've been given is just what we're hearing from other employers. We do have remote jobs on our iowaworks.gov job bank. I think we have listed over 500 on there now. So it's more prevalent, obviously, but as far as the schematics, that's essentially up to the employer. And we have not at this point given any guidance on how they want to do that. Every scenario is different, obviously, depending on whether you're a manufacturer, it's more of an administrative position. So.
Okay, so here's a question for you, and I think for Jasmine too, from what you're seeing at your side of things. This is about working from home. I work from home for 18 months approximately. Now we're coming in at least I'm coming into the Gazette so many days a week. And so it's eventually just shuffling from batches. I keep seeing what I forgot at one place that I need to bring to the other. But do you have any kind of sense for how well Iowa companies are doing, keeping up with the challenges of supporting a workforce? And do you have any sense of how many are doing some kind of hybrid thing? Jasmine, are you hearing that from the businesses that you talk to, or how many are actually even, and can we do this? And I realize a lot of jobs just don't work. That's a long question, but you know what I mean.
No, that's okay. Yeah. So again, this is just going to all be rooted in anecdote, right? So these are just the conversations we've had with employers. We haven't done anything to, we haven't done a formal study on any of this, but I would say that particularly for some of our largest employers in the area, what we're hearing is many of them actually still have at least some contingent that's work from home. So, and will probably continue to do so. There are certain employers who I think were, sort of like everything else, COVID sort of forced everyone to work differently. And so conversations, I don't think anyone was completely unprepared, except for maybe in some, like I know having worked for the city of Cedar Rapids, you don't really think of government employees ever working from home. So there were some that were maybe a little bit caught off guard, but I think for a lot of the employers, they were having these conversations about work from home just because of the tight labor markets in general for professional staff, that's really who this applies to most, as Peter had mentioned earlier. So when you're talking about being competitive as employers, I think a lot of people really see work from home as an employee benefit, or having some ability to work from home because of work-life balance. And so I think most employers who had been having this conversation and then basically forced to make a decision, so made decisions to invest in software systems, made decisions to invest in all kinds of new technology. I think most of us have been on Zooms now for 18 months, but even using owls for hybrid and how does it work and how do you get people to communicate that are some in person and some virtual. So I think that there is some degree of this that will be with us forever. I think that there is a lot of it that does come back to individuals who maybe were working from home for that period of time that have now returned to the office and sort of are wanting that flexibility back. But anecdotally from employers, I think the main part of the conversation that we're hearing is, it's still going to be rooted in them assessing case numbers. And they say, a lot of them will just say, hey, we've been doing it for this long, so we're not going to make any rash decisions at this point. So, I think most people left the office thinking it was going to be a 2-week stint. And here they are now, we're like, getting close to this 2-year mark. And at this point, it would just be not the best to make a hasty decision when our case numbers aren't to where they feel comfortable. So I think, it's sort of a mixed bag all over the place. But at a lot of these companies, they have both. They have professional staff who have been working from home, and they have frontline workers who, for any number of reasons, have been working through the entirety of the pandemic. So, I think sort of all over the board. I'm guessing Ryan probably is similar.
Yeah, same thing. I mean, it just obviously depends on the industry, but I can completely agree. I do think there are some employers that are looking to different ways to hire people remotely to still get the work done. It just depends on the different scenario. And then you talk to the information technology sector, they'll tell you we were doing remote before the pandemic happened. And so it just it's all over the place. But I concur with what Jasmine said. That's the same stuff we're hearing as well.
Well, I think we heard that term over the summer, and the Great Resignation, right? That there had been a lot of that stuff, and I think a lot of that's driven. There's a lot of dynamics that play into that, but a big chunk of that is that we're just seeing this real realignment around this issue around remote work. And now that we've proven out that it's possible for a lot of positions, and a lot of companies have adopted it that may have been reluctant to for one reason or another. Now we're in that world. Now we're getting to this, the next phase, which is which employers and which types of jobs lend themselves to that, right? And which individual people want to make those choices. Some people very much want to be in an office and want to be physically there. They feel more productive and more satisfied with their work in that scenario. Other people are very, very much the opposite. So we're seeing this very rapid, and it's going to continue for a little while, realignment of which companies offer that, which companies can thrive doing that work, and which employees want that offering and will thrive doing that. And that is a very different kind of alignment or match up of skills and employers than it was 2 years ago. And so as we kind of all individually ourselves figure out what kind of work arrangements I like to have, and which companies figure out which ones work for them, we're going to see all these people kind of trying to realign to where those things are. And that's a mess. But ultimately, hopefully it works in a good place. But in the meantime, it's a lot of churn to work through when we're dealing with so many other things too.
Yeah, I remember early on, lots of people who didn't want to work from home. And now, do we have to come back? And I'm glad you made the point, Jason, that there are people who want to work from home and they aren't really doing as great a job working from home as they did when they were coming into an office. And
that's the other thing too. I teach performance management, and that's the other thing that managers are really challenged with now. And in some ways, it's a good way, because we're having to really rethink how we evaluate or how we determine how somebody's performing in a job, other than just how many hours they're sitting in a chair in our buildings. So that's a good thing. That's a very good thing. But but you're right, is that, it'll look different, and there will certainly be some people that prefer to work from home but simply aren't as productive, or not don't perform their jobs as well. There'll be some portion of that. So, and what do we do about that, right? And how do companies resolve some of those discrepancies? And how do we even measure those things is really challenging.
I always try to start any kind of one-on-one with a reporter or photographer, whatever. How are you doing? And now that question means something more than just how are you doing at getting your work done? Because they're dealing with a sick dog or a child, or they're dealing with the plumber, or the basement's flooded. And I have to care about that now. I always cared, but I have to care even more. So are you seeing any bright spots in economic data, Peter, that show that the pandemic is changing people's willingness to save money or reduce debt as they receive COVID-19 assistance?
Well, savings actually increased in the pandemic, and I mean, the question is that all that pent up potential demand going to get released into the market as inflationary pressures, especially if we don't have a good supply response, because firms are constrained in terms of how much they can produce because they can't find workers or they can't find inputs. There's a whole lot of supply chain problems that may not be short term. I think some of them are likely to drag on a little bit. But I think the biggest issue is going to be on the labor supply side. I think that's the biggest puzzle right now. It's everything that we thought we were going to be able to fix hasn't really been particularly compelling. You have a few states like Utah that have actually increased employment in the last 2 years, and you go, okay, what are they doing right? And I think the answer is they're in Utah. I mean,
you mean because of skiing and scenery?
I think it's actually, to some extent, they didn't get hit as badly by the pandemic to begin with. So they were a little bit late I mean, there's an advantage to being a hermit if everybody else is dying, I suppose. But I don't think that there are lessons you can take away from Utah and say, okay, this is the right thing to do. Just as, if you look at policies in Iowa and policies in South Dakota and policies in Nebraska, the decline in labor force participation in Nebraska and South Dakota was not as large as it was in Iowa. So it's sort of hard to figure out, how is it that we're that different than South Dakota and Nebraska? I don't have a good answer.
Okay, we have a question about, for those with small children, is there any effort that you see being done to help with childcare? And I will point out that tomorrow's workforce panel, one of our panelists will be Dawn Oliver Wyand of the Iowa Women's Foundation. And I'm going to ask her about the surveys that I think there were two. They did statewide surveys in which they determined the two biggest issues about getting more women back into the workforce were childcare, transportation. But Jason, what are you seeing and hearing about what companies are doing because the question's been brought up, we should address it. What are they doing?
It's interesting because, I mean, there was a trend, 10 years ago where there was a lot of employers that were moving to like having on-site daycare and those kind of things, and that has been reduced, going the other direction over the last few years. I mean, pre-pandemic, I think we were seeing less and less of it. So the employers didn't want the liability. They weren't necessarily, there was obviously a lot of cost with it, but I don't think they were seeing the benefits that they thought they were from it. And now I think you're starting to rethink it the other way. And I think there's a debate about how much is there a government role for some of those things versus individual employers for that stuff. Because as I mentioned earlier, with all these choices about working from home, a huge chunk of that we're not talking about that drives those choices or those decisions is childcare, right? Especially during the pandemic when there's choices about school, right? And so where the traditional model was I could send my kid to school and then I go to work, and we're both in a place that when we have online school and I make if I'm making a choice not to send my child to in-person school because of any kind of number of reasons, health and safety or otherwise, it's really a challenge. And I haven't seen, I think just with all the other things going on that employers are dealing with, I haven't seen a lot of yet, at least anecdotally, of employers thinking about that, but it's it's certainly, I think, on a lot of people's minds, but I have heard a lot from the policy standpoint about what that means. And is that drive just more of a public or a government solution for some of these things versus an employer solution? And that's obviously got its own debate around politics and money and all those things too.
Michael, real quick, quick plug. The child care task force that took place over the spring and then the early summer. There was, if you go out to the futurereadyiowa.gov website, you can find all this information. I believe there was over 50 employers across the state. There's a map listed there where you can look at who received the Child Care Challenge Fund grant to help come up with different ideas, whether they were in essentially communities all over the state. The map is populated border to border, if you will, and river to river. So that's one thing. There's going to be the report that'll be coming out in the near future as well. And then we are obviously doing some summits around the state of Iowa starting this week as well in our local offices and in some of the community colleges as well. And childcare will be talked about there as well. So just an FYI on that.
Yeah, I think it brought up an interesting dynamic. I have a 2-year-old, a toddler, and I was one of the fortunate folks who was able to take my daughter. Even though I was working from home, I was able to take my then 1-year-old over to my parents' house, and they could watch her, and I didn't have to make any hard decisions about like, do I feel safe or unsafe, especially during those kind of very early days when we didn't know much about the virus. So I think that there is so many factors that are playing into this childcare conversation because, will things change once vaccines are widely available? I mean, we'll start to see some of that now in coming weeks, as Pfizer is saying that 5 to 11-year-olds will be eligible, and then for younger kids even there. But I think that, because of the fact some parents were scared, some parents were taking their kids, but there's just so much illness, right? Like I've had staff members out for, every week it's, RSV, it's hand, foot, and mouth, because all these kids are just, whether their antibodies were suppressed for a period of time or whatever it was, it seems like every kid is getting everything this year. But that becomes unreliable. So whether you have a daycare shut down because they had an employee who had COVID, or there was an expenditure, a kid getting sent home because they had a fever, I think that childcare was pretty unreliable for people for a period of time. So for individuals, maybe where, if they were looking at it and maybe they are working a job, moms who maybe were saying, okay, if my net take home is $200 at the end of the month, once I factor in what I'm paying for childcare, and we're maybe, especially in service sector jobs where they were laid off for a period of time, I think people had a lot of hard conversations with themselves and were forced to make choices and forced to figure out how to do more with less in some instances. And as a result, that could very well be a big part of this. You're seeing more stay-at-home moms because what's the, is the $200, $300, whatever it might have been, the net that I'm taking home each month really worth it to me anymore, to have all these additional problems versus just staying home. So I think there's still going to be a lot of that story that we'll find out as sort of some of these other data inputs change with vaccine availability and all kinds of other things.
Thank you. And we are at time. So thank you. Thanks to our panelists for taking time out of their day. And thank you for watching. If you've not yet done this, and I don't know why the heck not, register for the Iowa Ideas Conference. That's October 14 and 15. That will be online. You can do that right here. We're going to have David Gould as one of our keynotes. He's visiting professor, University of Iowa's Public Policy Center. Peggy Whitson, NASA astronaut, will be with us. And Thomas Abt, who's the author of Bleeding Out: The Devastating Consequences of Urban Violence. There will be other panels this week. You can register for those right here. We're talking about some of the same things. And you can also see the interview I recorded last week with Andy Challenger of the Global Employment Firm. Not enough caffeine. The Global Employment Firm of Challenger, Gray, and Christmas. And that's on our site too. So thank you. Thank you to our panelists. I know you folks have lots to do, and I appreciate your taking the time to be with us today. Thank you.
My pleasure.
Thank you.
Thanks.
Thanks.